Oh my God! Don't worry, they'll grow back. Just spread the seeds on, keep them watered, and watch them grow.
Come on. Missing nutcrackers, farewell to arms, and the dangers of chain wallets.
Chain wallets.
Get ready to laugh because today we're back at it breaking down and reacting to the most ludicrous medical scenes and hysterical injuries from Family Guy number 21. Let's dive right in.
I'm tangled. I'm tangled in your wallet chains. Stop!
Oh my gosh, who remembers wallet chains? I don't know if they're a thing anymore. I think my older brother still uses one.
I can't feel my arms. One of you tattooed Betty Boop ladies, help me!
Oh my gosh, come on.
Come on!
Do we get instances where people come to the emergency department where they get simple things wrapped around a part of their body part which causes an issue? Yes. Something that's quite common is something called a hair tourniquet. It happens in little kids where the hair actually wraps around like your finger or toe. Sometimes we'll actually use Nair, which helps remove hair, so it actually breaks down the hair itself.
Hi, I'm the lead singer of the Cherry Poppin' Daddies. My name doesn't matter. Please, don't wear wallet chains to our shows. Otherwise, you could end up with both arms ripped off like this guy.
Wow. In this circumstance, could you actually rip somebody's arms out? Potentially, especially at like joints. If the joint is able to be dislocated, that joint can be ruptured in the sense that like the ligamentous attachment will be pulled apart.
Peter?
Uh-oh.
Oh, Peter, thank God you're awake.
Well, what happened? This should explain everything.
Farewell to arms. Oh my gosh. Can you put those arms back on? If you have the arms and it's a very clean cut and you have the anatomy there to be able to do it, there's a potential.
We couldn't reattach your arms. Oh my God! Don't worry, they'll grow back. Just spread the seeds on, keep them watered, and watch them grow.
Come on.
Come on!
Wait a minute, why are they removed at the shoulders first off? Because that's not where the injury was. They were pretty much like mid-arm. All I can think about is Ryan Reynolds and Deadpool. This is the same thing.
Peter!
Tia.
Oh my
See,
gosh.
they're already coming in.
There are individuals out there that do have their hands proximally attached like that due to multiple different reasons, and they actually have the ability to function normally, and they actually are thriving.
You see, Kev? Nothing's gonna stop you in the real world except for your own cardiovascular system.
Hey, I'm only heavy because Adam Sandler made me gain 60 pounds to be in his movies.
So that's supposed to be Kevin James. Yes, so if you are overweight, it increases risk of cardiovascular disease. So sometimes you could say, oh, I'm healthy now, my blood work looks perfect, but it just increases demand on your system.
Demand suddenly skyrocketed.
Oh.
Ah! What happened to your hand?
I don't know.
Let me guess. One of you chuckleheads has a nutcracker inside you. What? No.
Hi, we're non-judgmental interns, just here to observe.
False alarm, not what I thought.
Oh my God. Not cool at all. If you go to a teaching hospital, an attending physician might have on their team residents, interns, medical students, even pre-med students observing. And there are times when patients will say, oh, I don't want that. Oh.
Kevin, your arm. It's getting worse. I think I see what's going on here. Kevin is fading away because streaming has made him irrelevant. Sitcom stars like Kevin clearly need the laughs of a studio audience, or he may disappear forever. His hair was disappearing too, but I assume he took care of that another way.
Typically, hair loss, it happens as we get older, and that's normal, but sometimes people have early hair loss or male pattern baldness or alopecia. There are different things that you can do. Hair transplants, you can use different topical medications, you can use oral medications.
Oh my God!
Hey, could you close the gate? A couple of calves got loose. Pow!
Pow! Looking pretty jacked and ripped. At first I was confused about the nipples.
Nipple confusion.
I don't know dog anatomy well, but I didn't know that male dogs had that many nipples as well. Let me know.
What does your girlfriend think of this?
I dumped her. She couldn't keep up with me. Hey, grab me some more Band-Aids, will you? I got like 8 more nipples to cover up before my run.
So I don't know if any of you out there are runners, marathon runners, but typically people will cover up their nipples with Band-Aids due to the chafing that could occur from your shirt, rubbing against it, and actually can cause bleeding, it can cause cracking of the nipples, some dry skin, really irritated, so that's why people do that.
Whatever you're doing, It isn't healthy, Brian. Oh, I'm not healthy? Stewie, my heart rate is down to 4 beats a minute.
4 beats a minute is not sustainable with life. He's dead, Jim. I don't care what animal you are. No. A typical human heartbeat is anywhere between 60 to 90. Once it starts getting over 90 into 100, we call it tachycardia. When it starts getting below 60, we actually call it bradycardia.
Brian, I think you've taken all of this too far. You know, there is such a thing as too much exercise. Stewie, I know you're worried, all right? And no offense, but I'm not taking advice from a guy who eats bread.
Bread makes you fat?
I mean, bread is good if you eat the appropriate bread and you're not eating it all the time. You know, you really want to stay away from refined carbohydrates, a lot of sugars, but like fruits and vegetables are fine. Oh, I was not ready for that. Holy cow. Obviously, the anatomy is not perfect. Lower extremity anatomy below the knee would be made up of your tibia and your fibula, but there's no fibula here. The fibula is a structural bone that runs along the side of it, makes up the outer ankle and the little bump on the outside of your knee.
Peter, I'd like to introduce the surgeon who will perform your procedure today. Dr. Wagner.
Dr. Wagner. They're alluding to potentially the surgery that Peter is having. They're doing procedures nowadays that could adjust the physical anatomy. That is not my expertise or specialty.
Where do you think you're going? Doc, I'm not actually going through with the operation. I'm going home. We're doing this whether you like it or not.
Doctors cannot assault individuals. We get into situations where family members really don't want us to let somebody go home, but if somebody is of sound mind and can understand the consequences of their actions and is not endangering anybody, you cannot hold people against their will.
Doc, no! Stop him!
And so he's got a scalpel that almost looks like a 10 or 15 blade, probably a 10 blade. The 11 blade is what we would use more often in the emergency department. We would use that to maybe cut open an abscess or help put in central lines that we need.
Yeah, well, you know what else takes years of specialized training? Crossing your eyes.
Whoa!
Too far! Too far!
Who can cross their eyes out there? I can. You ever hear like, don't cross your eyes and somebody slap you in the back and you end up permanently that way? Yes, that's not true.
Hold still.
Yes, you couldn't get your pupil to go to the other side, but you can get different size pupils. That's called anisocoria. You can have that typically with increased pressures of the brain and then other ocular dysfunctions, the pupillary reflex that is abnormal.
Thank you, Korean sweatshop animator. You've earned your nickel this week.
There's something super rare called polychoria, where you have 2 working pupils in the same eye. I've never seen that. Family Guy, hilarious. Okay, so good. I'm glad that they do this so I can react to it and glad to share my knowledge of medicine with you guys. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you did enjoy this, definitely check out this playlist right here. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.